Welcome back to Real Life. You know, when you're going out and presenting yourself in public, and these days more and more often, it's people who are trying to re-enter the workforce. You're going out to job interviews. And when you're doing that, you want to feel your very best and be very confident. For many people, when it comes to hair loss, that can really put a crimp in how you feel about presenting yourself. And hair loss doesn't have to be forever. We found Dr. Robert Jones, who's going to talk to us about that today. First of all, thanks for having us here to your clinic.
I'm very happy to have you here.
Yeah. Sure. Now, I've always been curious about this because it seems like, you know, baldness was something, especially, well, men and women experience it. But for men, it just seemed like, well, it's in my family and that's what I'm going to be dealing with as I get older.
Well, it's an option to deal
and it can be.
It's an option whether you want to decide to be bald or lose your hair at this stage. There's many things people can do for thinning hair. There's medical options. There's 3 medications that are available to sort of help with thinning hair, as well as hair transplants that will also thicken up your hair. So there are many options people have these days.
Now, we have Don here, and he's undergone an actual hair transplant here with you.
Yeah, both Don and I have had hair transplants. Yeah, I'm not only the doctor, I'm a patient too.
And it's amazing, right?
Yeah, well, if you take a look, and if you look at my before photos compared to what I have today, there's certainly a huge difference in the amount of hair I have. And the same as Don. We actually
You've got a lot of hair going on here.
Thank you. Well, this is about 6 months worth. Don had his procedure done last July, so it's about 6 months out. He'll have about double this by the time we're done with him. Plus, we're planning a second transplant next summer. So by a year and a half from now, we should have about 4 times this amount of hair. So you can see huge difference compared to the before photos.
Now, when we're talking hair transplant, what really is the procedure all about?
Well, basically, the hair on the back of the head is permanent, and the hair on the top is genetically programmed to fall out. So people, you look at fellows in their 70s and 80s, they all have permanent hair on the back of their head, or they all have hair that is there for the rest of their life. So what we do is move these follicles up to the top. And by doing that, those follicles will continue to grow for the rest of his life.
Wow. So is this you have to get individual hair follicles and move them?
Well, what we do is, we take the hair out of the back and then we dissect it. We've got microscopes in the back where we dissect those under the microscope into 1, 2, and 3 hair grafts. And then we just basically plant them into needle holes. So you can see here, that looks perfectly natural. Nobody can detect that from a normal head of hair. You look at mine too.
Yeah, it's amazing.
Perfectly natural.
That is, I mean, it must be quite the perfect tedious little job to do. I mean, that's tiny work.
Well, with Don, we transplanted about 3,500 grafts, so about 7,000 or 8,000 hairs in a sitting. So the surgery actually takes about 7 or 8 hours, but it's done at this table. There's a television in the room. We have 100 videos that people can watch, so they're very comfortable during the procedure.
That's good. Now, is anybody a good candidate for this?
Not anybody. You need somebody with a good donor site and not a huge area to cover on the top. Now, Don's got nice thick hair at the back, and was a good candidate, fortunately. Don, actually, the way we ended up doing Don's hair was he's an auctioneer, and we thought it was a good way to raise some money for charity.
Right.
So we ended up raising $25,000 for a good cause, and Don donated his head.
That's awesome. Now, would you have been a guy that came in here before all this to see Dr. Jones?
No, I think I'm probably one of the people who would have lived with the fact that my father was bald, my grandfather was bald, and it's a family thing.
Right.
And really, it was only through this opportunity that I gave Dr. Jones a chance to show his stuff.
Now, I also want to mention, what was the charity and what got you doing this?
Well, Dr. Jones has children at Appleby College, and I also work for Appleby College, an independent school in Oakville, and the proceeds were going to help with the school.
Oh, that's pretty neat.
Yeah.
Wow. And so now that you've actually undergone the procedure, you're a pretty happy guy.
Yeah, you know, it really has made, it's hard to say, but people really do notice the difference. And I'm probably not typical because most people who have this done, I think, are a little bit more private about the fact that they've had it done. And everybody in town knew that I had it done. Yeah. So there was no sense me hiding the fact.
Well, you look great.
Well, thank you very much.
I can't wait to see the next phase as we move on in this. Now, for folks who are even thinking about this, what's the first step?
Well, first step is to find out if you're a good candidate. Any surgery, the number one thing is to pick somebody that is a good candidate for the surgery, and the easiest way to find out is to come for a consultation or send me pictures, and I can pretty quickly tell you if you're going to have a good result.
Okay. Now, people that want to get in contact with you, we can do that on the internet.
Just drrobertjones.com.
That's a pretty easy way to do it. Thanks for having us, and I want to come back and see the next phase, the next generation.
Well, we should do another story in a year's time. And
what do you
we'll see
say?
some more
Thank
hair.
you. That'd be great.
All right. And we'll be back with more on Real Life in just a moment.
On the